Hello out there in television land. Welcome to the fastest 30 minutes in television history. Maybe it'll be faster than that. I'm with my bride, and we're, of course, starting another segment of It's Your Health. Happy summer. It's been a while since we've been together, so you must have a lot bottled up to say.
Not me.
Now listen, we pride ourselves in truth here, so we'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information, and make sure you check with your healthcare provider before doing any of the things, and I mean any of the things that we do here on It's Your Health. Be right back.
Welcome to It's Your Health, and there's our girl, Virginia Jane, the star of the show. She wants to remind you that if you have pets, make sure they're getting their heartworm medicine and their flea and tick medicine, too. Before we begin, I have a question.
This sounds bad. Go ahead.
You said before the break, check with your healthcare provider before you do anything, right?
Correct. Yes, I did.
Okay, well, you're my healthcare provider.
Oh, is that right?
So isn't that a conflict of interest?
You don't listen to me anyway.
That's true. Okay.
You know, when we got married, she changed her name. I don't know if you knew that or not.
Of course I changed my name.
Her last name was Wright. Her first name was Always, and she changed mine to Never. So there you go.
And how more accurate could you get than that?
There you go.
Honesty, wasn't that what you said? Truth?
I think we're starting the show. Do you want to?
Oh, sure, I'll be happy to.
Start our headlines.
Okay, the first one. Eating more blueberries and strawberries is linked to better brain function. Eating berries at least once a week may protect the brain from age-related memory loss. Oh, that's important.
Yeah, again, it's those antioxidants that are in red things and blue things, cherries, blueberries, strawberries, all those berries which are going to be very plentiful, of course, this time of year. Chalk up on those. And it cuts down on the inflammation that's going on in our bodies, and in that way lowers a lot of disease risks. And
it's really healthy when you get a big dish of vanilla ice cream exactly. And you put lots of blueberries and strawberries on it. You can't beat it.
I don't get to see that.
Never mind. Next one. Sex and the elderly. STD risk often ignored. The rate of sexually transmitted diseases has more than doubled among middle-aged adults and the elderly over the last decade. But the reasons for this are unclear.
Well, there's a number of reasons, I think. First of all, people are living...
How would you know?
I read about it,
oh,
okay.
I
think. I've heard that people are living longer, and of course they're lowering the barriers. What used to be a sin in the past is no longer sinful. Of course, we have Viagra and those aids, which men will use, which will put them kind of back in the batter's box, if you will.
You know what else? When people think that they're past the age of getting pregnant, they don't use some prophylactic.
Right, they don't use things that would prevent STDs.
Right, because they don't think of that.
Well, yeah, that's true. I don't think of that, so you're right. But there are a number of reasons. In fact, I recall a report, not to mention names, there's a retirement village down in Philadelphia, down in Florida rather, where the STD rate, the sexually transmitted disease rate, is like 30% among the geriatric population down there. So
they just spread the cheer and happiness among themselves.
Did I tell you I'm going down there this winter?
Are you ready for the next headline?
Yes.
Okay. We couldn't even get through the first segment, could we? You couldn't even get us through the first segment, could you?
What is it? I didn't even remember.
Just be quiet. Menopause, brain fog.
Oh,
brain fog may be real. New research finds differences in menopausal memory problems and age-related memory loss. Along with hot flashes and night sweats, memory problems are a common complaint of menopausal women. Changes in women's brains as they go through menopause finds difference between normal memory loss and menopause-induced memory loss. What'd you say your name was?
Yeah, never right. Do you remember?
Yeah. Okay.
That is a real thing. It's multifactorial, of course. It has nothing to do exactly with entirely estrogen, but that is a part, if you will. And it's just part of, unfortunately, our aging process. You can get
it's not your aging process.
A senior moment.
It's my aging process.
So, we're going to talk about things in later shows to come about how you can lower your risk of Alzheimer's, increase your memory, and things along those lines.
That's good. I have questions for you from the public now.
Okay.
I was always told to keep Ipecac in the medicine cabinet. Now I hear I shouldn't. What's the correct answer?
I'm not even sure you can get Ipecac. That's that stuff that if you want to induce vomiting, you drink it, and about 20 minutes later you vomit. I'm not so sure that's a good idea, especially in kids.
That's for like if you take a poison.
Exactly.
Oh, I see.
So we don't want a poison that goes in there to come back out sometimes. If you take Ipecac and then go to the emergency room, that may change the way the doctor in the emergency room is going to treat you. He may not be able to give you activated charcoal and the other good stuff. And by the time you really get the Ipecac in you, the poison could be pretty much through your stomach. And so it's not a good idea. If you have it in your shelf, throw it out.
I read that if the person has ingested something like bleach, that you can do as much damage bringing it out as it was going in.
Yeah, so we don't induce vomiting at home unless somebody tells you to. When she's cooking.
I knew he was going to say that. I knew it. I knew it. Okay, another one. I'll know I'm having a heart attack because my chest and arm will hurt, right?
Not always. You're lucky if you get the chest pain going down the left arm, and then you can pretty much say, maybe this is my heart. But very often, particularly in women, you get very odd symptoms. You may feel weak, you may feel tired, dizzy, you might get heartburn. Not everyone gets the classic chest pain going down the left arm.
And so stuff very simple, such as fatigue, loss of appetite, sweating. You think it's all due to menopause.
No,
you don't pay attention to it.
Right. And keep in mind that sometimes up to 30% of the time we develop heart disease, it's silent. So that a third of the time you may have a blockage to your heart or other arteries, and it may be a silent condition. And I think that's why you need to check with your doc.
That means you.
Yes, I guess so.
Okay, I will do that. All right, here's something that we hear about on television a lot, road rage. And it's identified as any unsafe driving maneuver performed deliberately and with ill intention or disregard for safety.
And I'm telling you, it's really out there. I dread driving around anymore. I mean, you have these people on cell phones and they're running red lights and stoplights. It's very dangerous out there anymore.
But that's not road rage.
But you can add to it by flipping somebody off or gesturing to them or making matters worse. So try to avoid the situation. Try to talk yourself down rather than adding gas to the situation.
Yeah, like don't look back at them or make faces or whatever. If somebody cuts you off, they cut you off.
Yeah, just kind of go on with your life and get away from the situation.
Somebody runs you off the road and wrecks your car, just let them run you off the road. Okay.
Be that as it may.
Yeah, we won't go into that.
I told you it's the fastest 30 minutes in television history. We're going to be right back with this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information, right?
Right.
Always right.
You're always right.
Welcome to the second segment of It's Your Health. Philip Benyo here with my bride, Mrs. Always Right.
All right, that's enough of that.
Okay, I'm glad. So, what do you have next in your bag of potpourri here?
My bag of tricks are some more headlines. They're always interesting. The FDA approves new erectile dysfunction drug named Stendra. Just what we need. Another drug to help male enhancement. That's great. Don't worry about trying to cure cancer. Let's try to help. Never mind. Stendra from Vivus Incorporated. expands the available treatment options to men experiencing erectile dysfunction and enables patients to choose the most appropriate treatment for their needs.
Well, football season's coming up, so just what the doctor ordered, if you will. But it's very interesting, these whole line of drugs. Initially, Viagra, a lot of people don't know this, was actually formulated as a blood pressure drug. And they gave it to people to lower their pressure. And it turns out...
And those people kept smiling.
And how it lowers your blood pressure, it redirects the blood into the pelvic area, which is why you can't take nitroglycerin with some of these drugs. Your pressure will go too low. But it's caused a revolution in men's ability to step up to the plate, if you will.
Women don't call it a revolution necessarily.
Oh, right. But you know what's interesting? I had a patient recently who came into me, and this is the take-home message, who had ED, erectile dysfunction, and he hadn't been seen in a while. We do a general exam, and here what happens is he has an underlying problem. His cholesterol is up, he has a blockage to his heart, and so what appeared to be one thing was actually a manifestation of another. Had we just given him Cialis or
Stendra.
Right, and let him on his way without doing a further evaluation, we would have missed something. So
wow,
when you have
important.
ED, something else is brewing, if you will.
This is a headline, but I'm going to turn it into a question. Okay, when you go to stay at a hotel, what is the dirtiest spot in a hotel room?
Geez, I would think someplace in the bathroom.
That's a very good guess. And it's wrong, Mr. Wrong.
Never right.
The dirtiest place is the remote control for the television, followed by the switches for the bedside lamps even have fecal material on them, and sponges and mops the hotel housekeepers use run a close third. So be very careful, and if I can offer my own advice, don't use the bedspread. Take it off the bed. Those are washed about once a year, we're told, so you really don't want to lie on it or use it.
So where are you going to hotels? Because I haven't been one in a while.
Trip.
Well, I haven't been to one in a while.
That's
so,
because you never go anywhere.
Well, it's I like staycations.
You don't take any of those either.
Really? Okay. Moving
Don't
on.
get me started. You'll be very sorry. He's already sorry.
You're right.
Okay. Study touts benefits of salad dressings made with monounsaturated oils. We've heard that word before. When it comes to packing a nutritional punch, a colorful salad can't be beat. Yes, it can. Vanilla ice cream with berries on it is very colorful, too. But the dressing you choose may be just as important as the vegetables for maximizing the body's intake of important nutrients.
When's the last time you made a salad? How can you possibly talk about this?
Oh, can't you make one with vanilla ice cream and blueberries and strawberry?
Well, what we're looking at here is picking a salad dressing that does not have saturated fats. Saturated fats are very difficult for the body to break down. The unsaturated or mono oils, as they're talking here, particularly olive oil, canola oil, those type of oils are beneficial for salad dressing. So either buy one that has unsaturated fats, or maybe make your own, which is better yet.
Safflower and sunflower oils are good too, right?
Yeah, absolutely.
Okay. This isn't a headline, but this is very interesting. There's an environmental group that gives an annual report on the worst offenders in the line of fruit and vegetables. Apples, again, have the dubious honor of nabbing the top spot on the dirty dozen list of produce with unacceptable pesticide levels.
Right, so you're at the store or whatever and you pick an apple off the shelf, you don't want to eat it. It is chock full of pesticides which would be harmful, and apples, for one reason or another, is the one that you got to think about the most. But we have a list here of others that are particularly bad. In other words, you just got to wash these things and wash them very well, as you would with any.
Yeah, don't just run them under the water. You've got to wash. Wait, but spinach, who cares? That can be taken off. Nobody uses that anyway.
Doesn't it go with blueberries? And no, I guess.
Nah.
But we do have on the second screen here a list of user-friendly fruits that are probably less contaminated, if you will. So,
sweet corn.
You want to mention that, I guess.
Asparagus.
Yes. Okay.
They're not the fun ones.
Fun fruits.
Why is it always that way that the fun ones are bad for you?
Oh, jeez.
Okay, as long as we're talking about food.
Oh, okay, that's
what we're talking about,
fruits,
you know.
yes, indeed.
Okay, we're talking about good foods for eye health. The same healthy diet that's good for your heart and arteries can help preserve your eyes and vision. Vision depends on tiny capillaries that supply the retina and other parts of the eye with nutrients and oxygen. So tell us about that.
Well, antioxidants again. The B's got it, the B vitamins. Don't forget your fish oils. Very important for eye health. Is there anything else I missed?
Yes, you did miss
okay.
Vitamin C and E, and even some zinc.
Yes, that's true. I've forgotten that. Thank you, sweetheart.
Yes, that is true. It is absolutely true. I knew that it was true. And we have a lot more to go over. Do you want to go over it now? I could... Oh, look what we have coming up in the next segment. Male menopause. This is going to be fascinating. So stay tuned, stay with us. We'll be right back and explain all about their excuses for male menopause.
If you wanted to get your ice cream and blueberries, now is the time.
Yes.
Welcome back to the third and final segment of It's Your Health. I'm here with my bride. And speaking of which, I wanted to tell our listening audience out there, and viewing audience, whichever the case may be, about a priest who was challenging his young children who were studying the catechism. And so the priest asked little Johnny, he says, "Johnny, how many times can a man get married?" And Johnny says, "Father, you're allowed to get married 16 times. And Father said, 16 times, Johnny? Where'd you hear that? Johnny says, "Father, it's in the vows. It's in the vows of marriage. You have 4 better and 4 worse and 4 richer and 4 poorer." And that's 16.
Just cut that segment out, Sammy, and let's keep right on going.
Well, I thought that was some comic relief here.
Are you finished?
Yes, okay.
Okay, we'll go to our headlines, but don't worry, male menopause is coming up.
Oh.
Okay, our first one is about antibiotics. We all know that word. They're medicines that kill bacteria, and bacteria can cause infections. They're powerful, but they can't cure everything, and sometimes we think we need an antibiotic for everything.
It is. It's 70% of the time if somebody comes in with a cold, sore throat, it's probably viral. Could be allergy. Try not to pressure your doctor into giving you an antibiotic. The antibiotics will create side effects. It adds to drug resistance. And some of the antibiotics, if you take them, you can get what's called a C. difficile infection. It's a diarrhea that requires a different antibiotic to get rid of. And it's been a big problem, particularly in our area. People who come down with illnesses will come down with the C. difficile infection. It's a diarrhea that you don't want to have.
Yeah, there's a study that people who go to the doctor's office want to leave with medicine. But we know that if you have the flu, antibiotics aren't going to help that.
No, if it's viral, it's just going to go its course.
We agree on that. So you were right that time.
Okay.
Okay, next headline. You lie out in the sun hoping to get a tan. Well, I hope you're not doing that, but instead walk away looking like a lobster. What can you do once you have a sunburn?
Well, prevention, of course, 90% of the problem here. You have to either wear a hat or use a good sunscreen. Once you have the sunburn, believe it or not, a couple aspirins, if you're not allergic to them, will take the redness out within 24 hours. I like to use aloe. Get your
Nice,
girlfriend.
common.
Get your girlfriend to put some on your neck and back, and it'll.
Just grow some. You cut off a leaf, cut it down the middle, open it up, and just use it just the way it is. It works tremendously. You can also use cold compresses. If you use a cream or a gel, put it in the refrigerator first before you use it.
Yeah, we've had a couple of nasty second-degree sunburns. Sometimes you need a little steroids to kind of cut down the inflammation, so hope you're not there.
And drink a lot of water.
Good advice.
Thank you. I thought so too. Okay, an abscess. You know what an abscess is, but not everybody does. I'm going to tell them.
Oh, okay. I'll just sit back here.
Okay, you do that. An abscess is a tender mass generally surrounded by a colored area from pink to deep red. They're often easy to feel by touching. The middle of an abscess is full of pus. Yuck, I hate that word. Painful and warm to touch, abscesses can show up any place on the body. Okay, it's all you.
And we've all had abscesses. If you were growing up, you had acne, perhaps, and acne is small abscesses underneath the skin that are full of pus. And of course, these things get sometimes worse, particularly if you have diabetes or circulatory issues. They can go into the bloodstream. You can become quite ill. And so when in doubt, take it out. You have to drain the pus and perhaps be on an antibiotic and try to find out why you decided to get this to begin with.
But you shouldn't drain it yourself. You shouldn't, like, squeeze it yourself, right?
No, I wouldn't do that. And we used to, of course, in the emergency rooms when I worked, would have people who would put black salve on things that would bring it to a head, or they would get a safety pin and put it under a match and then stick it in.
And then they'd get an infection on top of everything else.
So don't do those things.
Okay. Next one is a question that came in. Please know that all the questions get forwarded to us, so feel free to send them in or email them to us. This person wants to know how to eliminate dry mouth.
Yeah, well, make sure you don't have something.
I have that.
Do you really?
Yeah.
You have to stop talking as much. That's one of the keys of cutting out on dry mouths.
What else?
Sometimes medicines will induce a dry mouth. There's a rheumatologic disease called Sjogren's syndrome, which you have a dry eye and a dry mouth. So I would kind of review things and make sure you're not on medicines that are doing that, or that you don't have diabetes, for example. What now?
Or you can be like Darth Vader.
Oh, breathe through your nose?
That works too.
That does work. Don't breathe through your mouth.
And coenzyme Q10 is supposed to help.
So I've heard.
Next question related also to the mouth. Tell us about chapped lips.
We see that very commonly this time of year because they can get sunburned. So be careful about that. Again, medications can induce dry, chapped lips. Sometimes, believe it or not, the lip balms that are out there make it worse because they have phenols in them. And the phenols are alcohol derivatives that dry it out even further.
Ooh, and it says that phenols are strong antiseptic chemicals used in cleaning.
Right.
Wow.
Was there anything else that you wanted to add?
Yes, cocoa butter is a good choice.
Okay.
All right. Now we're getting to the good one. I know you've been waiting, so have I. Male menopause. Symptoms include flagging energy. I have to lay on this sofa and watch the football game. More pounds around the middle. A duller mind. Could they get any duller? Less drive and ambition, sore muscles, and a libido at half-mast. What do you do for male menopause?
Well, guys do go through that, and you may want to get your T level checked. Sometimes you see those commercials, testosterone. You may have another medical condition. You could be anemic. You could have underlying blockages. Usually, if you look hard enough, we can find out the reason why you're going through these symptoms. Some people can be depressed, believe it or not.
What's the number one thing you tell everybody for every symptom that they should be doing, especially me? Exercise. It's the number one treatment for those feelings. And then, of course, there's good old zinc and vitamin C.
Right. But usually you can find a reason why you're not feeling quite well.
And this old adage about cruciferous vegetables. You want to explain what they are? Because they're supposed to be good if you're going through male menopause. Notice it doesn't mention night sweats or any of the other problems women have. Go ahead. Cruciferous.
I forgot. Yes,
what
cruciferous. They're like broccoli and cauliflower. Something.
That's it. I mean, after all of that, his answer is they're like broccoli. Good enough for me. We're so happy that you joined with us today. Virginia Jane is so interested in what's going on. Very, very quickly, do patients ever ask you for a prayer when you're in with visiting?
Absolutely. And spirituality is part of your physical health, your spiritual health. And very often we will employ a higher power because, in point of fact, that's where the healing comes from. We're just instruments, if you will. So absolutely, I think prayer and faith is part of the healing process, and don't be afraid to use it.
Good answer, Doctor.
Thank you.
You're welcome. How about telling everybody how they can be in touch with us?
Oh, man. I'm not good with that.
459-9813 is the number that you can call. We're located on Broad Street, or you can stop by my shop, Kathleen's Collectibles and Drums, and drop off any questions or comments you may have.
And see Virginia Jane.
And see Virginia Jane, and of course, she will greet you at the door.
Thank you for allowing us to come into your home, inform, and hopefully entertain you. This is It's Your Health, your leader in healthcare information. Thank you so much.